So we're going to start our Q&A session now. So if you do have any questions, pop them in the chat. I've been too engrossed in everybody and have let all of our panelists go over time, so I'm going to shorten the Q&A session a little bit. But I'm going to start off with a question for Barbara. And the question is around AI. So the question is that you mentioned the potential to include AI in your virtual menopause clinic. How do you envisage this happening, and how far away are you from achieving that?
And so the integration of AI will be useful for our integrative health questionnaires, looking at symptoms and then tracking personal choices of women for whether they choose to use lifestyle interventions, treatments, or medicinal treatments, supplements, or a combination of all of those. And so we will track those journeys and track outcomes at each visit so that we have long-term data to see what's working for women. And then that helps craft the decision-making trees on how to guide providers based on the information that women have supplied to us. We are, it's a conversation in our company. We haven't implemented it yet, as we are still in our startup phase. And so we're not there yet for AI, but the platform, our software was built to incorporate the AI for the future.
Amazing. And Dr. Isabel, I wonder if you wanted to speak a little bit about how you've also brought in AI and how that works in your company.
Yeah, sure. We have two key areas where we focus our AI models on. The more obvious one is the early risk detection. We started off training our models with CDC data to mainly discover typical clusters or typical patterns of symptoms and biomarker combinations, but also lifestyle habits. I mean, if I should take a guess, I would take obese people over 45 and say, okay, let's try. But that's a very dumb estimate. So you can do this a little bit smarter, because until people really go here in Switzerland and Germany, it would be a pharmacy and get this long-term glucose measurement. It takes a little bit longer to take blood, so it helps to have very smart estimates. We also realized that we can detect, that's something we learned by surprise, that we can detect really well early patterns of people who have a mental health, a special behavior of mental health that indicates us a little bit in advance if especially depressive or burnout symptoms would follow afterwards. We tested that with Zurich Insurance 1.5 years ago. And then third thing is the second area where we focus is really on this personalized nutrition. It's called precision nutrition. It's a part of precision medicine, and it basically implies that each and every person has a very, very individual list and doses of ingredients that we digest well. So we don't know yet if it's intermittent factors like the microbiome or our genes are really and how they are influencing. There are no studies yet that could lead to that deduction, but we can really see how people react differently and have different symptoms after what they eat. And that's how we tweak it then optimally, next to the health goal, next to the history of diseases a person might have.
So it's really kind of based on the individual, which is, I feel like that came up a lot. I guess one of the questions I personally have is around what role the individuals play in controlling their own health, or whether it's more the role of government to kind of implement those. And I think, Debbie, in your chat, you were talking about how often it's kind of under research and there's not a lot of medical training around prolapse. And I wonder if you think that it's on like the government to kind of implement more medical training on those kind of topics?
Interesting. I don't know if it's the government necessarily, but even, within gynecology, that's my thought as why are there certain things that we scan for? I'd be curious on Barbara's thoughts on this, but, like breast cancer, of course, you go for your mammogram, but the chances that you have breast cancer are probably much slimmer than the chances that you might have pelvic floor concern. Of course, one may be life-threatening, the other not, but I think there are some things that could be screened for, and it could start with the consumer herself. Why is it that the consumer wouldn't necessarily go in and ask for pelvic floor review and ask for that kind of diagnosis or screening? I do know, and maybe this is what you were referring to, what I mentioned is that I believe in France that when a woman leaves a hospital or a center after giving birth, she is immediately put in touch with a pelvic floor support person. Whether it's a trained nurse, I don't actually know, but it is someone who works in pelvic floor support, and she's automatically from day one given that kind of support, which is not done in a lot of other countries. And so that could be a place to start.
And Barbara, I wonder if you have anything on that, because I feel like they.
I would like to add a comment with regards to pelvic floor evaluation, if I may. And so here in the US, as part of a standard OBGYN residency, you get extensive training with regards to evaluation of the pelvic floor that's done usually at a well woman visit. But I think so if you're seeing a gynecologist or an OBGYN for evaluation, you're going to get that information. But I think there's a lack and a discrepancy in the medical education and the experience with internal medicine, family practitioners. They get a very short window of a gynecology rotation here in the US. And I don't think that the training is robust enough for them to really recognize the subtleties of pelvic floor dysfunction until they're really quite dramatic that the patient is bringing it up. In addition, I do love the idea. We all know that the damage is done usually with the first vaginal birth of a child. The literature is pretty clear on a lot of those things with regards to pelvic floor. And to think that we could explode prevention of pelvic floor dysfunction by incorporating the use of pelvic floor physical therapists. So I don't know anything about the program in France, but that's brilliant. And we should all be vying for having those services after a vaginal delivery, because I think that education is really important.
Yeah, I think it's key, and just like an individual standpoint as well. I think Hila kind of mentioned it in her presentation that a lot of women just aren't aware of these things, or even who to go to or how to describe or talk about them. So yeah, I think that's really, really key. I think there's a question from the audience. Hien Nguyen, sorry if I'm mispronouncing your name. You asked whether if you can go through audio. I think if you'd like to speak and ask your question. Okay, I will come back to you. Yeah, we've got a question for Kate as well in the chat around why is advanced cosmetics a trend in 2021?
Well, we think that it's not just 2021. I think the momentum has been building up. And I realized that, our panelists today talked about very important implications to human health that also come with aging. Skin, if we take the main focus of our report, is the largest organ. It also plays an important role in our self-esteem. And the good news is we see a good shift from the artificial plastic surgery, artificial approach that has short and long-term effect to something that is connected to high tech and has long-term effects. And in terms of women's health and men's health as well, because it could be of interest indeed for both genders. It improves your well-being and self-esteem. So it is wonderful to see how there are lots of advancements in this space, and they don't have to cost a fortune. And I think that's going to be a big improvement to everyone's life. Well, as a woman, I would definitely agree with that.
Definitely, yeah. I think it's so exciting to kind of see the advancements that are coming out in the space and the innovations. Another question I personally have is around like what role we think stigma plays in this kind of lack of access of knowledge or uptake in health services. So Hila, I guess there's not a lot that's been researched on menstrual blood before, and maybe that's one of the barriers. But do you think that's to do around stigma and shame, why menstrual blood hasn't been researched before?
Totally. Like this is it's unbelievable, the ignorance and the lack of knowledge. Me as an engineer in this space, and I need to develop a vaginal device, I have so many parameters that are missing. Basic parameters like shape, forces, sizes. It was never only recently there is starting to be statistical information about vaginal sizes, vaginal length, vaginal forces. So it's quite unbelievable. I can tell you from my own experience in this field of fem health or female health. This is my second company in this field, and I've been experiencing, sorry for the lack of a better word, but total ignorance. People just do not want to hear, they do not want to talk. And I'm really, really happy with all of the changes that FemTech is now doing, and hopefully things will change, because when you look at the money in this field, it's not enough. We have so much research to do. Even I'm sorry, I'm going back to menses because this is the closest to my heart. Like researching changes from one to one, day to day. Is it the same? Like there is so much you need to study that we don't know. So we have a lot to do in this space. So
I agree. There's such a lack of research, and I think Rachel touched on that on her talk as well, and just about the need for the right language, but also for more research. And I guess a question for you, Barbara, is like, how do you think that kind of lack of vocabulary or like shame and stigma around women's health impacts the clients or the users of your app?
I think that a lack of a comfort with vocabulary really is a negative for us as women. We need to come together and say, it's okay to call a vagina. It's okay to call a vulva. It's okay to mention the word clitoris. It's okay to talk about orgasm. It's okay to say that sex hurts. And when I listen to Rachel's talk, I can tell you ads that we put on Facebook or social media get rejected when we mention that vaginal pain, or we use proper medical terminology, and they get rejected, and they say that they're too sexual or too intimate. And so this idea of kind of shutting down the language that we use is perpetuating the negative aspect for all of us as women. And I think that we need to go and say to Facebook and social media and all these other programs and say, hey, you know what? We're using proper medical terminology. This is how we need to speak to one another. This is educating and empowering women to make choices and go up against those social media determinants and change our narrative and change the conversation and take a stand. And so, you know, if we all kind of come together and use a common language, and that language is the basis for the future, then we can really make a change in that aspect for women, where women are then comfortable to go to their doctor or their provider, or even talking to their significant other and saying, this is a problem for me, and coming for solutions to get help in all of the great technology that was presented today. It's having that conversation and being comfortable.
I completely agree. And this kind of social media banning, it comes up so much in any conversation I have around FemTech. And I've recently published a video on FemTech Live that was just kind of doing a comparison between women's health and men's health. And there's just such a gender bias there. So yeah, I really do think there's a need to open up that conversation. Debbie, I wonder how that also impacts kind of, yeah, your users and your clients.
Could you repeat the question? I'm sorry. What impacts our clients?
So the kind of knowledge around the body, how does that kind of impact your?
Yeah, I mean, I referenced it maybe briefly in my talk, but as I mentioned, prolapse is not even a word familiar to many women. I think the knowledge, and even I think Rachel mentioned, you don't even know what your body parts are doing. And sometimes, look, incontinence can be a symptom of a lot of different things. It could be prolapse, it could be stress urinary incontinence, it could be overactive bladder. You know, you really don't know exactly what's going on. I think there's not enough knowledge for the consumer herself and access to good medical education for the consumer with all this, you know, kind of crazy stuff that's out there. So that's part of what we're working towards, is looking at different options for providing really quality education for women in this area, so they know what can happen in their body, what to ask about, and what they can do about it.
Yeah, I think I hear education, awareness, and conversation from all of you, and just kind of promoting that a lot more. And I think that is really key. We've run over time, so I'm going to cut the Q&A there. But if you do have questions for our panelists, pop them in the chat, or if you scroll through the chat, their kind of LinkedIn profiles and stuff are there, so you can reach out to them as well.